Join me as I dive deep into the signs and symptoms of autoimmune diseases, and see if I can identify if I'm dealing with one myself. Autoimmune diseases are a group of conditions where the immune system mistakenly attacks and damages the body's own tissues and organs. It's a complex phenomenon that affects millions of people worldwide, and yet, it's often misunderstood or overlooked. The truth is, that autoimmune diseases can be silent assassins, creeping up on you without any warning signs. That's why it's crucial to recognize the symptoms early on before they wreak havoc on your health. Early detection can make all the difference in managing and reversing the damage. Unfortunately, many people struggle to get an accurate diagnosis, and instead, are left with a laundry list of misdiagnoses and ineffective treatments. It's heartbreaking to see people suffering needlessly, simply because they don't have the right information. The more I learn about autoimmune diseases, the more I realize how critical it is to spread awareness about this topic. By recognizing the warning signs and taking proactive steps, we can take control of our health and prevent needless suffering. So, let's dive in and explore the world of autoimmune diseases together. Many of us have heard of conditions like rheumatoid arthritis, lupus, or Hashimoto's thyroiditis, but there are over 80 known autoimmune diseases, each with its unique set of symptoms and characteristics. It's a complex and overwhelming landscape, and that's why I want to shed some light on the common misconceptions surrounding autoimmune diseases. One of the biggest misconceptions is that autoimmune diseases are rare. The truth is, they're more common than you think. In fact, according to the American Autoimmune-Related Diseases Association, an estimated 50 million Americans are living with an autoimmune disease. That's roughly 20% of the population. Another misconception is that autoimmune diseases are solely genetic. While genetics can play a role, environmental factors like toxins, infections, and even dietary choices can trigger or exacerbate these conditions. The takeaway here is that it's not just about bad luck or bad genes. It's about understanding the complex interplay of factors that contribute to autoimmune diseases. Many people believe that autoimmune diseases are only affecting older adults. However, the reality is that these conditions can strike anyone, regardless of age, gender, or ethnicity. In fact, many autoimmune diseases disproportionately affect young women, often in their 20s and 30s. Another myth is that autoimmune diseases are always obvious. The truth is, that many people can experience mild or vague symptoms for years before receiving a diagnosis. It's not uncommon for people to be misdiagnosed with anxiety, depression, or chronic fatigue syndrome, when, in reality, they're struggling with an underlying autoimmune condition. The more I learn about autoimmune diseases, the more I realize how critical it is to listen to our bodies. Our bodies are incredibly intelligent, and they're always sending us signals, whispers, and warning signs. The problem is, we often ignore or dismiss these signals, thinking they're just minor issues that will resolve on their own. Autoimmune diseases often masquerade as other conditions, making diagnosis a challenge. For instance, thyroid conditions like Graves' disease or Hashimoto's thyroiditis can mimic depression or anxiety. Similarly, autoimmune polyendocrine syndrome type 1 can present as a host of seemingly unrelated symptoms, from fatigue to digestive issues. I've spoken to numerous people who've experienced symptoms for years, only to be told they're fine, or that they're just stressed out. It's heartbreaking to see people struggling to find answers, simply because they don't fit into a neat little box. Let's talk about some of the common symptoms of autoimmune diseases. Fatigue is a big one, but it's often dismissed as normal or attributed to lifestyle factors. Joint pain or inflammation could be written off as arthritis or overuse. Skin rashes or lesions might be blamed on allergies or eczema. Digestive issues like bloating, cramps, or diarrhea are often seen as minor complaints, but they can be indicative of underlying autoimmune conditions. Even neurotransmitter imbalances, like serotonin or dopamine deficiencies, can be linked to autoimmune diseases. One of the most frustrating aspects of autoimmune diseases is that the symptoms can be so vague, making it difficult to pinpoint the underlying cause. It's like trying to find a needle in a haystack, except the haystack is your entire body. If you're experiencing unexplained symptoms, or if you've been struggling to find answers, don't give up. Keep pushing, keep seeking, and most importantly, keep listening to your body. Let's dive deeper into some of the most common autoimmune diseases, their symptoms, and how they can be misdiagnosed or overlooked. Hashimoto's thyroiditis, for instance, is an autoimmune disease that attacks the thyroid gland, leading to hypothyroidism or hyperthyroidism. Rheumatoid arthritis is another common condition that attacks the joints, causing inflammation, pain, and stiffness. Lupus is an autoimmune disease that can affect various organs, including the skin, joints, kidneys, and nervous system. Multiple sclerosis, or MS, is an autoimmune disease that targets the central nervous system, leading to a range of symptoms from numbness to vision loss. Type 1 diabetes, an autoimmune disease that wipes out insulin-producing beta cells, is often misdiagnosed as type 2 diabetes. Psoriasis is an autoimmune disease that causes skin lesions and scaly patches, often mistaken for eczema or skin allergies. Crohn's disease and ulcerative colitis are autoimmune conditions that affect the gut, leading to diarrhea, abdominal pain, and weight loss. I could go on, but the point is, autoimmune diseases are complex, multifaceted, and often misdiagnosed. That's why it's essential to work with a healthcare practitioner who's knowledgeable about autoimmune diseases. Now, I want to share a personal story that really resonated with me. Sarah, a 35-year-old marketing executive, had been experiencing joint pain, fatigue, and brain fog for years. Her doctors told her she was just stressed out, or that she was suffering from anxiety. But Sarah knew something was off. She felt like she was losing her grip on life, and her symptoms were only getting worse. After years of searching, she finally received a diagnosis of rheumatoid arthritis. The shock, the relief, and the anger all mixed into one. Why had it taken so long for someone to listen to her, to take her symptoms seriously? Sarah's story is a powerful reminder that we must be our own advocates, and that we must keep pushing for answers, no matter how long it takes. I want to share a few more stories because I believe that's where the real power lies. When we share our experiences, our struggles, and our triumphs, we create a ripple effect of awareness and understanding. Rachel, a 28-year-old yoga instructor, was diagnosed with Hashimoto's thyroiditis after years of misdiagnosis. She had been told she was lazy, that she was just stressed out, or that she was experiencing normal fluctuations. But Rachel knew her body, and she knew something was off. She fought for a diagnosis, and when she finally received it, she felt a mix of emotions. She was relieved, angry, and determined to take control of her health. These stories are a testament to the power of self-advocacy, to the importance of listening to our bodies, and to the need for greater awareness and understanding of autoimmune diseases. In conclusion, let's recap the key points we've discussed today. Autoimmune diseases are complex, multifaceted, and often misdiagnosed. They can affect anyone, regardless of age, gender, or ethnicity. Early detection is critical, and it's essential to work with a healthcare practitioner who's knowledgeable about autoimmune diseases. We must listen to our bodies, trust our instincts, and advocate for ourselves. I want to leave you with a final thought. Autoimmune diseases are not a death sentence. They're a wake-up call, an opportunity to take control of our health, and to make conscious choices that nourish our bodies and minds. Thank you for joining me on this journey. If you've experienced similar symptoms or struggles, please share your story in the comments below. And if you're new here, consider subscribing for more health-related content and awareness-raising videos. Until next time, stay empowered, stay informed, and stay aware.